Thank you. Let me ask some questions here, and if I could start, maybe I'll ask this of you, Administrator Shaw. In the early days of the response, the World Health Organization really, I think, failed their donors and failed the people of West Africa. But as I went down those arguments that we heard coming out of the region, that these were politically appointed country directors, and they were downplaying the crisis. They had warnings from credible organizations, and they ignored them. They failed to submit reports back to headquarters in Geneva. They obstructed travel by experts, and they resisted offers of assistance from the Center for Disease Control as well as from USAID. And you add to that it was the WHO guidelines on prevention and containment, which our own CDC clung to for far too long, in my opinion, that proved wholly inadequate. So today, the WHO continues to serve as the lead agency in the UN's mission for Ebola emergency response, and the administration is seeking more funds for the WHO. Now, we understand the funds for tackling this problem, but without reform at the WHO, I would just ask, do you have confidence that they're up to the task here if they're going to be the lead organization? And how has the WHO corrected course over the past several weeks? Are they making changes, especially considering the situation you had on the ground there?
Thank you, Mr. Chairman. I think the most important response to your question is that, yes, there have been very significant changes made at WHO to the quality, the personnel, and the focus on this response. That's true in all three countries. Part of my assessment and my trip was to assess all of our United Nations partners. Most of the investment reflected in the request are personnel, logistics, commodity purchase like protective equipment, and distribution. Those main cost drivers will end up being deployed by partners like the World Food Program that actually manage the logistics response over the medium to long term in the region. WHO plays a critical role on technical issues, on training support, on, in some cases, running Ebola treatment units, and they are working with our NGO partners like the International Medical Corps, Mercy Corps, Save the Children, and others to execute that function. So they play an essential role. We've worked hard with them to scale up their capacity, and right now we need them to perform, and we're going to help them perform, and we're going to measure results. And when we have challenges, I'm on the phone with my counterpart, the Director General there, very often in order to make sure that we have an open line of communication about what has to be done to succeed.
Well, the argument that I understand is that they have the experience, but the people at the helm, the country director for Guinea, the outgoing regional director for Africa in particular, demonstrated deadly incompetence in this situation. So the United States is on the executive board. We should figure out a way to reform the personnel process so that cronyism at the UN isn't a big part of the problem, and at the same time, perhaps figure out a way to have them bring more doctors and personnel and experts around the globe into this region, into West Africa, to confront the crisis. And I would just ask you about that. Besides management reform, can we push for such a directive?
Yeah, I think, well, thank you for the suggestion. I think we will take both of those suggestions on board. The new executive director from the United States is Dr. Tom Frieden to the WHO. He's very focused on those and other issues. And right now, you're right to point out that the World Health Organization is leading the mobilization of international medical support for this mission overall. And your points are well taken, and they're important, and we'll continue to push to make sure that function is implemented well.
Thank you, Dr. Shaw. Another thought we had was that we have, you know, with UNMIL's role, you have 6,000 UN peacekeepers deployed in Liberia, and their mandate there is to solidify peace and stability. And prior to this outbreak, they were winding down. But what role is UNMIL playing in the Ebola crisis, and does it have the engineering capabilities there to play a role? The mission's UN mandate will be renewed again, I think, in December. Will we see any changes in the mandate, or any needed, with respect to addressing this challenge?
I'll just say, keeping UNMIL both together, well-resourced, and operationally contributing to the response has been a major priority. When Ambassador Power made her trip, that was a point that she really drilled down on. We do believe they have important assets that include logistics support, helicopter lift, some degree of engineering. They're working with the main United Nations logistics provider, which in this case is the World Food Program, to scale up their contribution to the Ebola response. And we are very hopeful that all of UNMIL's contributing partners will maintain a commitment to keep that entity going and strong into the future.
And lastly, Dr. Shaw, you spoke of the supplemental request, but leaving the question of resources aside for a minute, and I am supportive on that, are there any additional legal authorities that would improve USAID's mission? And do you have all the authorities you need? What should we do legislatively in terms of policy that would strengthen your ability to tackle this challenge?
Well, thank you, Mr. Chairman. I think there are, in addition to the resources identified in the request, a few specific congressional authorities that we would seek. One is the broad transfer authority that would give us the flexibility to use funds across various foreign assistance accounts as needed over the course of the year. This will allow us to, if the crisis moves to Mali and we need to be responsive there, it allows us to be responsive. This would allow us, if the crisis is more intensely on food security and governance and the number of new cases is down, it will allow us to make balanced and appropriate judgments and transitions. Second, the notwithstanding authority for economic support funds in this context will allow us to move fast and effectively, and so we request that. And the two priorities, sir, that you have been a champion for in food security around continuing to allow us to have more flexibility to do what saves the most lives most efficiently, and to promote agricultural investments through Feed the Future will also be helpful. And I know those are in a separate process, but I very much value your leadership and the committee's support in those areas where we've proven that these investments can deliver the kinds of results that then avoid these crises in the future, which ought to be our goal.
Thank you, Dr. Shaw. We go to Mr. Engel of New York.